Now we are going to discuss the frozen shoulder. The shoulder joint is enclosed in a capsule of connective tissue, and in frozen shoulder, this capsule gets thickens and tightens, which ultimately restrict the movement on the shoulder joint. Frozen shoulder is initially very painful, and with the passage of time, as it progresses, it can restrict active and passive range of motion on the glenohumeral joint. The inflammatory condition and the frozen shoulder causes fibrosis of the joint capsule, and then gradually, as it progresses, it leads to the stiffness and adhesion in the joint, which ultimately results in the restriction of range of motion. And frozen shoulder particularly targets external rotation of the shoulder. Now, the risk factors for the development of the frozen shoulder. First of all, age and sex, females are more prevalent to have frozen shoulder as compared to men. The immobility or reduced mobility. The patient who are recovering from the surgery or having fracture or stroke keep their shoulder joint immobile for a long period of time, which ultimately leads towards the development of the frozen shoulder. Next is the systemic diseases. It is seen that in diabetic patient that they are more having frozen shoulder, while the muscle ache, tenderness, or stiffness in thyroid patient leads towards the development of the frozen shoulder. Now, the clinical presentation with which the patient came to the clinic, patient came with the extreme pain in the shoulder joint and decreased movement on the shoulder joint. And the main factor of the frozen shoulder is that there is loss of external rotation on the shoulder joint. Basically, the frozen shoulder is a self-limiting disease and symptom resolve with the passage of time. It can roughly take up to 6 months to 11 years, and the time duration varies in different patients. Patient also report that they are having a difficulty in performing activities of daily living, such as difficulty in grooming, dressing, performing overhead activities, and particularly fastening something behind the back. Now, the stages of frozen shoulder. First of all, freezing stage, which is called acute and painful stage. The second is the frozen and adhesive or stiffening stage, and the last is thawing and the resolution stage. Now, the graph show the movement and pain in three stages of the frozen shoulder. First of all, we discuss the freezing stage. In this stage, the patient is having pain even at rest and sharp pain at extreme of motion. Patient is also having pain even at night, which disturbs the sleep of the patient. It means that the pain is most worst in the freezing stage of the frozen shoulder. While in the frozen stage, pain start to subside, but the patient is having pain at extreme of movement. But the most important factor is that the patient is progressively losing the range of motion on the glenohumeral joint. While in the thawing stage, the pain subside, but there is significant improvement in functional range of motion on the shoulder joint. Now, the time duration of each stage of frozen shoulder. First of all, the stage one, which roughly lasts up to 2 to 7 months, and there is severe inflammation of the shoulder joint, while the stage two lasts up to 12 months. And patient is complaining that he or she is having difficulty in performing his or her activities of daily living because there is stiffness and adhesion in the shoulder joint. While the stage three lasts up to 24 months, and in some patient it lasts up to 3 years. Pain is subside, and patient is now recovering to the functional activities of daily living. Now, the assessment of the shoulder joint. First of all, the subjective assessment, in which we focus on the patient history. Carefully listening to the past medical history help us to rule out any red flag sign. Patient history of presenting condition, its pain distribution and severity, or any aggravating activities are assessed. Next is range of motion assessment. Cervical, thoracic, and shoulder range of motion are assessed. The key clinical signs of frozen shoulder are reduced forward flexion, abduction, external rotation, and internal rotation. If we look into the developing pattern of the frozen shoulder in patient, uh, first of all, if patient lose passive external rotation, then passive abduction and flexion, and then in the last passive internal rotation, then patient is following the capsular pattern of development of frozen shoulder, which is more associated with arthritis. But if patient is not following this pattern of development of frozen shoulder, then it is non-capsular pattern, which is associated with the extra articular pathology of the shoulder joint. Next is the resisted muscle test, which is performed in the seated position for the shoulder abduction, extension, and the internal rotation. Weakness in the asymptomatic side is noticed if patient is having frozen shoulder, or significant muscle guarding is also noticed. Then the joint accessory movement. For assessment of accessory movement, first of all, we have to review the couple movements. First of all, for the flexion and internal rotation, there is interior translation of the humeral head, while for the extension and external rotation, or abduction and external rotation, there is posterior translation of the humeral head. If someone is having frozen shoulder, there is most limitation is seen in the interior and inferior capsule, but the joint mobility is restricted in all directions. Next is the special test. There is no gold standard test for the diagnosis of the frozen shoulder, but there are different special tests or functional tests which help us to rule out the severity and how much functional range of motion is restricted in the frozen shoulder is assessed. Thank you.